What if the most dangerous disease is the one you don't feel, don't see, and don't even know that you have? Hepatitis B is often called a silent infection. In fact, many people living with this disease go on to live healthy life for years, going about their daily activities, unaware that the virus is slowly affecting their liver. On today's episode of our Facebook Live conversation, we will talk about hepatitis B, what it is, its transmission patterns, and most importantly, what we can do as individuals, communities, parents, and health systems to protect ourselves. My name is Marian Tabi, and joining me to unpack the facts around hepatitis B is Dr. Akudo Ikpeazu. She is the team lead for HIV, TB, hepatitis, and STIs at the WHO Regional Office for Africa. Hello, Dr. Akudo.
Hi, Marianne.
Welcome.
Thank you for having me. It's really a pleasure to be able to join this conversation.
Thank you, Dr. Akudo. But can you start by telling us what hepatitis B is and why is it called a silent infection?
First of all, hepatitis B is caused by a virus which we call the hepatitis B virus. Why do we call it a silent infection? Because a person can be infected and it would take years, decades, 10, 20, 30 years before they get to know that they have an infection or that there's something going on. And people would tend not to know until it has already started to cause difficulties with their liver, what we call morbidity. So people start to manifest things like liver cirrhosis, it might be liver cancer, it might be liver failure, very serious diseases before they get to know very often.
Wow, thank you very much. Can you explain how a person can be infected with hepatitis B?
It's interesting. Hepatitis B has many similarities in transmission to a disease which we know very commonly, which is HIV. And so hepatitis B is transmitted through blood and blood products. What do I mean by that? It can be transmitted through blood transfusion, through sharing of sharp objects like razors, barbing equipment, through sharing of needles, as you see with people who inject drugs. It can also be transmitted through sexual contact. But most important for us in Africa is the mother-to-child transmission of hepatitis B. So a mother can transmit hepatitis B to their baby.
Wow. Thank you for elaborating on those transmission patterns. I would like to move on to the next question to really find out how dangerous hepatitis B is if it's not diagnosed early.
Very dangerous. If it is not diagnosed early, some of those issues that I raised earlier can tend to happen. So if a person is not diagnosed early, you can have it progressing. It damages the liver. So it damages the liver through a process that we describe as inflammation, because the body is trying to come against the virus, and through that process the liver gets inflamed. Then the person can progress to what we call cirrhosis, can progress to liver cancer, can also have liver failure. So those are really major consequences of undiagnosed and untreated hepatitis B.
Wow. So moving on, once someone has hepatitis B, can it be cured? And how can people live to protect their health from it?
So first, let me just say that in terms of how you even know that you have hepatitis B, which is diagnosis, before now, you had to go to a big lab where they had to do complex tests. But the good thing is that today we have what we call rapid diagnostic tests, rapid test kits, through which people's diagnosis can be known within a very short time. And this is available in many communities, in many health facilities, down to the primary level. So that is a way in which people can first know whether they have they have hepatitis B or not. And then if you do find that a person has hepatitis B, there are options. It cannot be treated totally, but it can be managed. It can be managed like any other chronic infection, like diabetes, like hypertension, where people take drugs for life. So there are drugs that are available with which people can be treated. They can be provided. Some of them are a single pill a day, and over time, their health can be maintained, and they can have healthy livers.
All right. You had mentioned like mother to child transmission. I want you to really elaborate how can a mother transmit hepatitis B to her baby, and at what stage can transmission occur?
So there are three major ways in which a mother can transmit hepatitis B to their babies. And remember that I mentioned that it is through blood and blood products. So remember that a mother is carrying the baby. So during the period of pregnancy, through the placenta, there can be a leakage from the mother's blood to the baby. But that happens scientifically, we say maybe 10 to 20% of the time. But the more frequent one is actually during the process of delivery. Because, delivery can be a traumatic process where a lot happens. So during that process, we have most of the transmissions happening during that stage, but also during breastfeeding. However, the mechanism for breastfeeding happens when maybe there is a laceration, a cut on the mother's body, and then the baby has contact with it, and the transmission can happen. So it can happen through these three stages, whether it is during the pregnancy, during delivery, less frequently during breastfeeding.
So, I think you've mentioned how mother transmit that, but particularly, why are newborns, babies, and infants particularly vulnerable to this infection?
Of course, you know that when a child is born, their immune systems are very young, they are still developing, the whole system is young, and it needs to be protected from these external pathogens, diseases, external, whether it's viruses or bacteria, etc. So the fact that they're still under development is the reason that they can easily be affected. And I think that would lead me to talk about something that is very important, which is why we insist as WHO and as part of our guidance that a child who is born to a mother who has hepatitis B must absolutely be vaccinated within 24 hours of birth. That is one of the things that we put forward, one of the things we're supporting to ensure that we can make happen 100% of the time across all the countries. But also to say that for us, it is also the way in which we can protect future generations from hepatitis B. That is the most significant prevention tool that we have right now.
Thank you, Dr. Akudo. You've just moved on to the next question, which is what is WHO really doing? I mean, as a team lead in charge of HIV, TB, hepatitis, and other STIs, what is WHO really doing in the region to support countries to prevent, detect, and treat hepatitis B?
So, a number of things, and I'll start from the point which I just raised, which is, pushing forward very strongly this policy for countries to ensure that every child that is born to a mother that is hepatitis B positive can have the best dose within 24 hours. But beyond the best dose, it's really about also completing the other 2 or 3, depending on what the country's program is pushing forward, because we expect additional vaccination at maybe 6 weeks, 10 weeks, at 14 weeks. So it's really an important point. And like I've said, it's so critical for us as a continent to ensure that the next generation can be born free of hepatitis B. But beyond the policy guidance that we provide as WHO, we also are supporting countries to actually implement these approaches. So in terms of implementation, there's capacity building that is needed, and we have a lot of tools which we're supporting countries to adopt and to help them as they progress in their hepatitis programs. There is also one piece which is what we call integration. Marian, you see, we've learned over the past few years that we cannot afford to continue to approach our various diseases as individual entities, right? But that the people who are the recipient of the services, it's one person who may have to deal with several issues. So we're really advancing integration. For hepatitis B, it is very important because two very important things. One is how we deliver it. We see that across Africa, we have done so much with HIV, and there are a lot of similarities. And so we're trying to push forward to ensure that even at the primary level, we can have services for hepatitis. Hepatitis B used to be more of a specialized area where you had services being delivered at the secondary level. So what I mean by secondary level is that the more specialized hospitals. But now we want to see that at country level, people can test even at the primary healthcare levels in the community. So as you take one service, you should also be able to take other services. So integration and decentralizing services to primary healthcare. That is a major thrust of our work. But we've also recently set up, last year, the regional director launched a platform, what we call the Hepatitis Community of Practice, HEPCOP for short. Through that platform, we're supporting the countries that are the highest priority. Why the highest priority? They have high burden. We think that so much more needs to be done in those countries. We know that if we can make the shift in those countries, it will impact the picture overall for the region. So that platform is helping countries to share their lessons, to learn from each other, to learn about what is working, and to translate those lessons into what they are doing in their own country. So those are some of the areas in which we are working. Also ensuring that when there are new tools, we can bring this to the attention of countries. We can support them to adopt those new tools. And one such new tool is the example I gave earlier, the rapid testing for hepatitis, which we did not have in the past.
Wow, Dr. Akudo, quite a lot there. I don't want to close this forum without giving you the opportunity to share a simple message to our viewers, someone who is watching, maybe living with hepatitis B. What message will you like to share to any family that can help support them to better protect themselves or their loved one living with hepatitis B?
My message is simple. Get tested. Know your status. Know your hepatitis B status. It's possible to get tested because the tools are there. If you get tested and you happen to be positive, there is treatment available. So that's my quick message. The second part of my message is every family should ensure that when they have a newborn, they should ensure that they have the vaccination within 24 hours of birth. So get tested, know your status, and vaccinate every child.
Thank you so much, Dr. Akudo. As Dr. Akudo mentioned, get tested, know your status, and vaccinate every child within 24 hours of birth. Thank you so much for joining us today. Share what you've learned from this session today, and see you next time. Bye-bye.